Gut feelings, the overlooked link between scoliosis and digestive distress. Most people think scoliosis is only about bones, braces, or surgery, but the truth is that curved spines can twist more than just posture. They can upset the entire digestive tract as well, and that surprise is where our story begins. When 13-year-old Maya first visited the clinic, she was quiet, shy, and clutching her stomach. Her x-rays showed a clear S-shaped curve, yet her biggest complaint was not back pain. She could barely eat without feeling like a balloon. Every lunch ended in bloating so fierce she had to loosen her waistband. Bathroom trips were a guessing game between constipation and cramping, and spicy foods sent hot acid crawling up her throat at night. Her friends teased that she was the pickiest eater in school, but Maya sensed something deeper was wrong. As we traced the outline of her ribs and listened to her belly gurgle, a bigger picture formed. The same spinal twist that tilted her shoulders also squeezed her stomach, nudged her intestines off-center, and tugged on nerves that tell the gut when to move. How could anyone heal her curve without calming the chaos it was causing inside? That question is at the heart of this book, because Maya is not alone. In exam rooms and online support groups, people with scoliosis trade stories about constipation that lasts for days, reflux that ruins sleep, and sharp side stitches that dance along the ribcage whenever they laugh. Doctors often shrug, chalking it up to stress or diet, yet deep down many patients sense a connection between the twist in their backbone and the twist in their gut. Traditional scoliosis care, however, still points its spotlight at the spine. Degree measurements, brace angles, surgical rods. Gastrointestinal symptoms are treated as side quests handled by other specialists, if they are discussed at all. This narrow view leaves families juggling two puzzles at once and wondering why the pieces never seem to fit together. This book aims to change that. We will sail straight into those uncharted waters and map how a sideways spine can pinch the vagus nerve, crowd the stomach, kink the small intestines, slow the colon, and even alter the way brain chemicals that control digestion flow through the body. We will show why the simple act of sitting on a hard classroom chair can compress abdominal organs for hours, why a rib hump can reduce the space a stomach needs to churn food, and why chronic, low-grade inflammation from a sluggish bowel can in turn feed muscle fatigue that worsens the curve. We will pair each insight with clear action steps a reader can try at home, from gentle thoracic extensions that open the chest to probiotic strains that tame gas. To keep things real, every chapter starts with a true story from the clinic or the community. You will meet teens who balance brace wear with low FODMAP diets, college students who discover that yoga twists help both their spines and their stools, new moms who juggle nursing posture with reflux flare-ups, and active seniors who use gentle thoracic mobilizations to fight both curving bones and creeping heartburn. These stories ground the science in everyday life and prove that small, consistent changes can bring big relief. Speaking of audience, this book is for three groups. First, it is for patients of any age who feel the curve inside their bellies as much as they feel it in their backs. If you dread family dinners because bloating ruins your night, or if bathroom trips leave you anxious, the pages ahead offer both answers and hope. Second, it is for parents who watch their children battle two sets of symptoms at once and are tired of hearing they're not related. Here you will find practical checklists to bring to appointments, meal plans that children will actually eat, and reminders that your instincts are valid. Third, it is for practitioners, physical therapists, chiropractors, physicians, nutritionists, and health coaches, who believe true care should reach beyond a single body part. By weaving musculoskeletal strategies with digestive science, you will gain fresh tools to serve the whole person in front of you. Throughout these pages, you will also see gentle reminders that scoliosis itself is not a flaw to be erased, but a condition to be understood. By shining a light on gut help, we do not mean to push every reader toward surgery or a miracle cure. Instead, we aim to widen the lens, showing that a curved spine lives in a body full of organs, nerves, hormones, and emotions. If one part is struggling, the others feel it too. When we respect that truth, we can craft care plans that are both kinder and more effective. By the time you finish this introduction, you may wonder, why hasn't anyone told me this before? The short answer is that medical silos make it easy to miss patterns that cross systems. The longer answer is that research on scoliosis and digestion is still young, scattered across small studies and case reports. We have gathered the best of that evidence here, but we will also be honest about what is not yet proven. Where solid science is lacking, we will lean on clinical experience and patient wisdom, always marking the difference so you can weigh choices with clear eyes. We will cover anatomy, from spinal curves to intestinal loops. We will explore physiology, from nerve signaling to gut motility. We will tackle lifestyle factors, from screen time posture to late-night snacks. We will dive into genetics and epigenetics, explaining how certain DNA variants can raise both scoliosis risk and food sensitivities, and how smart choices can turn risky genes down. We will break down lab tests, imaging options, and wearable tech that monitors posture and digestion in real time. Along the way, you will learn simple self-tests that link posture to belly pressure, breathing drills that unlock a stiff diaphragm, and cooking tips that cut gas-producing carbs without stripping flavor. You will practice mindful eating habits, like chewing each bite 30 times and pausing for deep breaths between forkfuls, because slowing down a meal can sometimes be as powerful as any pill. You will see why hydration acts as a natural lubricant for sluggish bowels, how magnesium relieves muscle tension and stool hardness at once, and how a 20-minute walk after dinner can straighten spinal loading while speeding gastric emptying. Athlete or artist, toddler or grandparent, everyone will find something they can use the very same day. In short, the purpose of this book is simple: to make sure no one with scoliosis is left guessing why their stomach hurts or why laxatives only offer temporary relief. The solutions may not be one size fits all, yet armed with knowledge, you can piece together the plan that fits your curve, your gut, and your life. Thank you for opening these pages. Let us begin the journey towards straighter spines, calmer bellies, and a future where whole-body scoliosis care is the rule, not the exception.